So over the last several weeks, we've noticed that most of the emails we received from you ask us about senior citizens' health insurance plans. Now, with the rising cost of healthcare on one end, it's important to make sure that our parents who are likely to need that periodic healthcare most are insured. Thankfully, there are several products in the market for us to choose from, and most insurers are working on those products every day to innovate them and make them better. So how do you find a product that suits your family's needs best? We put together this helpful checklist. Take a look.
I'm not going to go down the emotional road and talk about all the love and support our parents have given us all our lives. It's our turn now, and doing the right homework for all their financial products is the least we can do in return. The Senior Citizens Health Plan is a non-negotiable component to our parents' portfolios, and it needs the most research. Now keep in mind that buying health insurance for a senior citizen comes with a lot of clauses and conditions. You might be tempted to include senior citizens in your family floater plan, but this will hike up the price of your entire product and will leave your family underinsured.
When you try to combine your parents into your own standalone policy, what happens, insurance companies start calculating the overall family size starting at the senior age, and the overall ticket size shoots up, where a standalone policy for senior citizen is usually cheaper.
So you need to pick a separate policy for your parents. But how do you choose a health plan that suits their needs? Here is a useful guidebook. For starters, you need to buy the policy as early as possible. Even though some health policies will let you enter even at the age of 80, the premium gets significantly higher as the age advances.
Typically what happens is that you will have a slightly higher premium per lakh or sum assured because these plans have been designed in such a way where the waiting period for pre-existing illnesses may be lower. As a result, there's a slightly higher risk to the insurance company, and that gets loaded into the premiums.
Next, ensure the policy covers your parents for as long as possible. Some covers are valid lifelong, while most others will cover senior citizens only till a specified age, usually between 80 to 90 years. Third, make sure your parents' pre-existing illnesses will be covered by a new policy. There is usually a waiting period of a year before the insurer will take on the responsibility of covering a pre-existing illness.
Pre-existing illnesses will be covered after the waiting period is over in senior citizen plans, subject of course to any particular exclusions which might have been made for a particular policy. In some cases, the pre-existing illnesses will be covered even during the first year, subject to, say, a maximum 50% cover.
The biggest medical expenses come from treating critical illnesses. Most senior citizen health plans cover a few select critical illnesses. So make sure you pick a policy that covers as many illnesses as possible and be aware of what is excluded from the plan. Finally, you need to understand the co-payment ratio on the policy. No policy will pay your entire hospital bill. You will have to pay a percentage of the bill, while the insurer will pay for the rest. You need to make sure that your share of the bill will be as low as possible, and that the insurance company will pay the lion's share of the bill.
Today, some of the products available for senior citizens have very high co-payment. They have co-payment ranging between 40 to almost 50%. So even if you take claim against hospitalization, you will have to pay a large amount from your wallet.
So here's a recap of what you should be looking out for. Buy the policy as early as possible. Choose a policy which offers lifelong coverage. Check for the waiting period of pre-existing illnesses. Check what critical illnesses it covers. And finally, find out what your co-payment ratio will be.